You are listening to Vitality with Marilyne, a podcast about health, wellness, and all things vitality. Having set herself free from life routines, embraced a healthy lifestyle, and lost an incredible 90 pounds in under a year, Marilyne is now supporting others looking to live their best life. Here to tell her transformative story and engage in enlightening and inspirational conversations, here she is, Marilyne.
Hello and welcome back to Vitality with Marilyne. Today we have a special episode focused on physiotherapy. As I've mentioned in the past, what got me started on my health and wellness journey has been, at the very beginning, was to find a solution for my migraine headaches that have been getting increasingly worse and worse. And throughout the assessments with my physician and all that, we've discovered, we actually did the MRIs and CT scans. And then that led me to seek physical therapy at some point to try and alleviate some of the pressures, and hoping that it was muscular, and fortunately it was. So physiotherapy has been a big part of my health and wellness journey, and I'm very excited today to talk about it a lot more. And I have the physiotherapist that I've been seeing for the past, since August, so that's 8-9 months now. And I'll tell you a little bit about Phanny in a minute, but I did initially seek physiotherapy for my migraines, and then kind of progressed into, because I've also been diagnosed with TMJ, which I'll let Phanny say that word in a minute, what it means, but it's basically an issue with my jaw, which puts pressures on my temples and also gives headaches. I've consulted and got physiotherapy for also repetitive strain injuries that I've incurred throughout the years, which have impacted my right arm and kind of limited my ability to exercise, as well as working on old injuries that was restricting, again, my ability to perform certain exercise. So it's been extremely beneficial for me. And I have been doing physiotherapy most weeks on a weekly basis, depending on what's going on. Sometimes I skip a week, sometimes two, depending on what's going on in the world. But I do consistently feel quite a bit of relief. And like I've mentioned, I've progressed to being able to use or to seek physiotherapy for different things. But we always kind of have a focus on the neck and shoulders to work at keeping the migraines at bay. So a little bit about Phanny, and that's information from the website, and we'll provide that information. Phanny is a registered physiotherapist who completed a Bachelor's of Science in Physiotherapy at the University of Ottawa in 2008. She has since worked in private practice and is offering treatments in both French and English. She has experience treating a variety of clients of all ages with acute and chronic pain, sports injury, and postural dysfunction. She's passionate about helping her patients and achieve realistic goals, and Phanny strongly believes in treating the source of the problem and not just the symptoms. Through her technique, uses manual therapy, and sorry to take a bit of segue. That was really appreciated and surprising on how hands-on physiotherapy has been. Having sought physiotherapy for other issues in the past, definitely can speak that it is very hands-on and manual, and I feel quite effective. And if I go back to the blurb, she also mentions that she's committed at taking on ongoing education and can provide a long list of different services, which includes acupuncture, functional dry needling, therapeutic taping, manual therapy. I will mispronounce this for sure. Myofacial. Got it. Yeah. Postural education, exercise prescription, running assessment, golf assessment, TMJ, which is
temporomandibular joint.
That, and chronic pain education and programs. So welcome, Phanny, and thank you so much. Well, welcome in your home, because this is your home office or clinic, we should say. So thank you so much for being with me or agreeing to do this and sharing what physiotherapy can look like. We did just tape a session, my weekly session, so we'll be able to demonstrate that for the viewers that are interested, especially the ones, well, if you're listening to this as audio, then make sure to go on the website and see the video of what physiotherapy, especially with Phanny, can look like. And if you're watching this, then you're probably seeing it or will be seeing it in a few minutes. So Phanny, tell me a little bit about what is it you do? What is physiotherapy at large? And yeah, let's start there.
Well, before answering your question, I just want to say thanks for having me. What you're doing right now is great, and I think it's going to help a lot of people. I love how it's like so genuine, right? And you're just really doing this to help, right?
Yeah. Thank you.
So going back to your question, so physio, what's physio? I guess the general definition of physio is that what we do is we help you restore balance, function of your body. And we help you achieve your goals, right? It could be, I want to run a marathon, or I want to play with my grandkids, right? Like in your case, Marilyne, your goal was I want to get rid of my headaches, right? I want to get rid of my headaches, my migraines. I want to see the doctor. I don't want to take any medications anymore, right? So, and we help you by increasing your range of motion, increasing your strength, reducing tension in your body. I guess that's more of the physical impact that we can have, but I think what's really important is education, right? So if we have, if I get a runner, for example, that has a running injury of his ankle, then he'll ask, okay, why am I getting this pain, right? What exercise should I be doing? When can I start running? What do I do if I do feel the pain? Do I stop? Do I modify? And going back to, I guess, your experience, when you started squash, for example, I think it was like the first session that you did squash, and you started getting a bit of that soreness on your neck, and you came to physio and you're like, I need to stop, right? Like, this is the sensation that I feel right before getting my migraine, so I think it's too soon. And then we kind of discussed, and then seeing like, okay, what kind of pain did you feel, and what was the intensity, etc. So, and it was kind of to guide you to modify it and not to stop it, because pain is normal, quote unquote, right? You have the good pain, you have bad pain. So I guess to coach you through that.
Yeah. And I recall you doing actually an assessment and saying, well, let's check and see if it really is, things have gotten worse from the previous week. And so that was a relief for sure.
And that's what I'll usually do, right? Like, you check your range of motion. Yeah. So you had good functional range of motion. So it's like, there's no damage to your joints or whatever. It's probably just muscular. And yeah, like I said, pain is normal. It's when you feel pain, it means that there is a change, right, in your muscles. You're gaining strength, you're gaining endurance, you're gaining maybe flexibility or whatever. It's like, I give the example, like, when, even if you don't have pain, you start, like, you've never exercised before, you pick up like a weight, you start doing bicep curls, you're gonna feel sore, right? So it's all normal. And then so I think education is a big part of physiotherapy, especially with like the internet right now and social media. There's so much information out there, and very good information too, like, that are reliable. But I think our role as a physio now, it's really education. We need to take lots of courses. Like, we need to continue to take courses and change our way of treatment so that it's up to date, right? So you're getting the cause of your headaches, right, is mainly because of muscles. Every muscle, I explain this to every patient, every muscle refers pain somewhere, right? It just happens that the muscles around your neck will refer up to the head. You'll feel almost like, oh, I'm getting like a sinus infection, or I feel like a headband that's pressing on my forehead, right? Or you can get tingling, numbness down the arms, or pain down the arm, okay? So then when I poke around, what I'm trying to feel is, and if there's any tension, and then you let me know if you have any pain. And if you do, and if you feel like it's reproducing like your headaches, then That's where it is. That's a spot, right?
And you've touched on pain, and I'd like to expand a bit on that. And well, first, before I stop, because we'll talk about my treatment plans and my injuries and so on. I just want to make it very clear that there's informed consent, and there's no problem in discussing any details of my assessment. And Phanny, as a professional, is bound by many confidentiality rules and stuff. So just wanted to clarify that. So if we're just going to go back on the conversation of pain, and that's what I found throughout, especially the fitness part of what I've been up to in the last year, well, almost a year, is that whole, like, because you experience pain, and sometimes it is intense, and it's like, what is good pain, bad pain? And there, you're right, like that. What is the pain that you can? How do you know that you can push through and not? Because your brain's telling you it hurts, stop. Mm-hmm. So I've very much benefited from having you as an expert throughout this journey. But do you have anything else to add about, when is that pain something you should look into or should really stop, or vice versa?
Yeah. And that's a really important concept for people to understand, right? Like if you understand that, then it's easier for you to progress the exercises, better for you to challenge yourself, right, in your sports, or to run that extra minute, because it is good pain. It's going to be okay. I guess we call it quantification of stress, right? When you do have an injury, you want to stress the tissues, because that's going to help with the healing process. So you want to load the tissues to a point where you're going to feel a bit of soreness, right? Which is good, but you don't want to load it too much that it's causing more pain and more harm. So it's that fine line that you got to find. And that comes, and you'll know that fine line, or that right amount of stress by trying the exercises, by repetitions, right? By doing the exercise, and you feel a bit of soreness, like, oh, is it like a 10 on 10, or is it just like a 1 or 2 on 10, right? And then and also like the big thing that I stress is, mobility, right? You have your full range of motion. So you do an exercise, you feel a bit of soreness, you drop the weight, it's like, okay, do you have full range of motion? It's like, yeah, I do. Okay, let's try to, continue and see, right?
So range of motion, if you're losing some, that's your body telling you.
Yeah, you've done too much, yeah. Right? And another one would be pain at night. Pain at night, because then it means that there is some inflammation, right? So, and if it's gonna happen with your progress with the treatment, and you're gonna have like little flare-ups, right? See, I feel it a little bit more in here. So yeah. The masseter is like, it's a little square muscle that closes the mouth, is actually the strongest muscle of your body. So with the clenching, you use a lot of the muscles here, so the masseter there, so you'll get some knots. The other muscle that closes the mouth is the temporalis here. Okay, so right here, usually we'll find some tension in the back fibers. I guess we call it the posterior fibers of the temporalis. So a little bit more sensitive today.
Yeah.
Also, when your head is a little bit more forward, you start using those muscles a bit more. It changes the way your jaw moves, right?
Very interesting. And to follow up on this is like, when should people seek physiotherapy? What are the kind of the clues that it might be time to either speak to their doctor about physiotherapy or go to a physiotherapist?
Yeah. The main one is pain, right? Most people that come into a clinic is like, oh, I have pain, or I can't do ABC now, or I'm starting to, walk a little bit differently, right? So anything that affects, I guess, people's daily activities or sports or exercise. Yeah.
And we've talked about this before, and that when things are progressive, or pain is progressive, and it's kind of slowly progressing to be worse and worse, and it's like we're kind of willing to seek help when it's pretty bad. So do you have any kind of advice on kind of like, if you're seeing that it's not getting better, it's preventative versus once it's gotten too bad, or, in terms of timing of seeking support?
As soon as possible, right? Obviously, preventative is the key, right? I find people will start thinking about preventative, I guess, treatments once they seek for, once, you have pain, you go see a physio or you see a chiro or massage therapist, and like, oh, I feel so much better, right? I'm able to run, or I'm able to do this or play with my grandchildren or whatever. And it's like, oh, I don't want this pain to come back. So what can I do to prevent it? I do find nowadays people are seeking for more preventative exercise or treatments because of social media, because of the internet, right? There's like pretty good channels out there that will show you like, oh, you should be able to do these exercises or start with that. And if you sit for too long, at your desk, you should be doing this, to help.
Mm-hmm.
Yeah.
And what's the most common reason your client seeks physiotherapy?
Pain again.
Yeah.
Pain. Sometimes it's just their doctors are like, oh, you should try physio. And just, I guess, in your case too, right? The doctor's like, go see physio, but you're like, oh, I saw physio already. It didn't really work.
For others, right?
And
for
then,
these reasons,
yeah. And then patients come in, they're like, okay.
And I think I recalled, I think I recalled you mentioning something like an increase in musculoskeletal disorder or injuries based on sitting and poor ergonomics and so on. I mean, the pandemic has kind of shifted us all from working from home and on the fly having to adapt. So you're seeing kind of a trend of that kind of going back, or is it still very much predominant?
So beginning of the pandemic, people were, I guess, in their transition from like at work to at home, right? Work. So yeah, I did see a lot of people with more neck pain and back pain and lingering pain too. Now I find work has adapted too. So they were offering, virtual ergonomic assessments and all that. So that was great. So I'm seeing a little bit less of that, but it's definitely still affecting a lot of people that have to do, let's say, like Zoom meetings where their cameras have to be on. Or last year when kids were doing virtual classes, the teachers were in front of their computers with 3 different screens and trying to engage, the kids. And it's that, again, like head forward or unable to move, right, and change positions.
It makes sense that at the beginning we all kind of did this temporary shift, and then as time progressed, I think we all kind of got more comfortable in their work from home spaces. The ones from us, for sure, and more awareness, for sure. And we've talked about my situation, but we attributed it to these long hours sitting hunched over in front of a computer, bad posture, stress, and so on. So there's a lot to be said, because you go about your day and you don't realize that you're causing injury. And for me, like the thought of like, oh, my work setup is making me sick was not okay. So then realizing, and we've discussed, taking breaks and standing and exercise and so on, but it never became so clear as when it was so intense that I couldn't bear the pain anymore. So, so we've I think we're on the same page. Physiotherapy, it can be very, very helpful. So what should people look for when choosing a physiotherapist, and what questions should they ask to determine is the right professional for them, or any tips to
So I get that question a lot. So especially with patients that, let's say, are moving and they're like, oh, I need to continue my physio. Like, how should I look for a physio? I tell them, check the website, obviously. Check the website, see if they have any, social media accounts that you can basically just creep on them, right? And see if you could, connect with them, right? If you're a swimmer, then you find a physio that's a swimmer, then they'll be more understanding of what you do and your activity and the injuries that, are maybe most likely to get with, swimming injuries or whatever. And or call the clinic. Call the clinic, see if you can talk to the physio, right? You can email them, and though they should respond they should take the time to talk to you, right, and to answer all your questions.
Because I feel there's a wide range of approaches to physiotherapy. I've shared with you a few times that my experience with physiotherapy went back to a long time ago, with having broken an ankle, and that was physical therapy to get back to the range of emotion and so on. That the ankle was restricted, so that was fine. That was one type, and included treadmills and assessments and so on, and exercise. And then another time was more on postpartum. So I had gone through pretty difficult delivery and back pain and so on afterwards, and I went to physio, got told to do certain exercise, sent on my way. And that was my sense of physio, is you go somewhere to tell you to do exercise. And unfortunately at that point, I had a newborn and so on. You go back, did you do your exercise? Well, not really. And it was kind of okay, well, this kind of guilty feeling. So what was surprising to me, and I didn't know physiotherapy the way you've done the work existed, or it could provide that kind of hands-on approach. There's also, I haven't experienced it, but I know there's sometimes machines that are used and so on, and I'm sure there's a whole range. But and I don't know if I'm making this hard for you to answer, but how does somebody know the type of physiotherapy or what's kind of going to work for them when they're navigating this? So they know they're at least convinced that they need physio. But I find it's hard to navigate, and thankfully I was referred. But
no, it is tough. Unless you have someone that's had physio before and they're like, oh, this is a really good physio, or I had this injury, this treatment works, that treatment works. So
which was my case.
So I guess when you do contact a physio, if you check their bio, check what kind of treatments they're doing, and then see if it, do your own research, right? I do dry needling, I do acupuncture. So if you're interested, you're oh, I'd like to try it, so let me check it out. Or the best way would be to talk to them. But I guess you'll know during the assessment, right? When you do meet the physio and then they do the assessment, you'll get a feel, right? And ask questions, ask all the questions, or have a list, right? Write it down and ask your physio or whoever, why am I getting this pain, or how come I can't do this, how come I can't do that, can you explain it to me? And I think that's one of the big thing with you, is that you responded, overall you responded very well to physio, right? But I think what helped you is that you do ask a lot of questions. The first time when you came in, you were why am I getting this? Why this is like that? Why am I feeling that way? What do I do if I feel that, right? So and
what I found remarkable for you is that, and for all professionals that I've worked with and throughout this and other parts of my career, I think it's important to find people that are passionate about what they do, and it comes through. You're in your zone when you talk about how the muscle, how it's all intertwined. I remember the first time you talked about the jaw, and you seem fascinated about the jaw and how, and there's words you say that I don't remember and it's not my thing, but you can really sense when somebody is into their work, they're passionate, and they really want to help and so on. So that came across loud and clear, and I definitely recommend looking for that kind of spark. And I mean, we all have our good and bad days at work, but you can tell when somebody really owns their craft and loves it.
And going back to your question, how do you know how to find a physio, right? And then when sometimes they'll say oh, are they gonna have time to speak to me? Are they gonna have time to email me back? I'm yeah, the good ones will, right? Because they want to help you. Regardless if it's, they'll help you, or they'll be like, oh, you know what, I'm not very familiar with this type of injury, let me refer you to this person or look into this, right?
Yeah, and that's a tricky part too, because I think one of the assumption is that physio takes a long time, and that they're gonna have to do it forever. So can you speak to that, on how long someone, depending on, I'm sure it depends on the injury, but how long can someone really expect to be in physiotherapy, and what does it depend on?
Yeah, that's a tough question. There's different injuries, so it all depends, right? I guess we'll know. I'll have a. Sorry. During the assessment, right? Like when you come in for your assessment, the physio will assess you, and then we'll have a pretty good idea, hopefully, of like the cause of your pain, right? And then it's usually after maybe the first couple treatments, depending on how you're responding to the treatment. If you feel better after the first one, then that's awesome, right? Then it's like, okay, well, we pinpoint where the cause is. So, let's do your exercises, maybe come once a week and then see how it goes. And if things are getting better and better, then, maybe space it out to 2 weeks or 3 weeks or whatever, right? Everyone's really different.
But it requires a commitment, and I think to manage people's expectation, you need to give it a try, more than a session or two, to make sure that you reap the benefits.
Yeah,
right?
So it would take about a few sessions. You should feel an improvement or a change. Yeah, so after a few sessions, you should feel a change. Okay, better. If it's better, then great. Physio is working for you, and then let's talk about like the frequency, right? Maybe we should push out the treatments. If there's no change, and that's when you want to be like, okay, like, is it musculoskeletal? Should you go back to see your doctor for more imaging or test, or should you see instead, I don't know, a chiropractor, another health professional, right?
Yeah, I like that approach as well as a referral. So we've touched a bit on the exercise and dealing with injuries. So it can be daunting to deal with injuries while trying to progress in an exercise program, especially if you're in a situation where you've got health and fitness goals and kind of going at it. So what do you typically recommend to people with those goals but suffer from back or neck or knee injuries, like the more the areas that can really slow you down with life in general?
Yeah. So most people that come in, they have a goal, right? They don't want to have any pain, or they want to be able to do a certain activity or daily activities, and setting realistic goals, right? Realistic goals that are measurable, right? So I want to be able to walk 2 blocks, or what's the distance, or what's the timeline too? Like, do you want to be able to do it in 1 week or 2 weeks? Is it realistic, right? Is it specific to your injury also?
I'm assuming you're having to have those conversations when somebody wants to run a marathon in a month, and you'd be like,
or like, I want to run a marathon in like 2 years. Like, okay, let's baby steps, right? Like, let's get you, I don't know, running for 30 seconds first. And the goals also change, right? Throughout the process and during the treatments, and
let's talk about me for a minute. So my progress, I think, and we've talked about how I came to you with migraines, and I was fully, open-minded to physiotherapy, but I was a bit, I didn't expect a whole lot, which I fortunately was pleasantly surprised. It's just at some point it was one of the parts that I was trying to see if I could work on my migraines. But if you think back into August 2021, what can you say about my progress? And you're very aware of my health and fitness, or health and wellness, I should say, journey. Yeah. So why do you think, what contributed to my progress and the success overall?
I the main thing is that you were on board, like you were sick of this pain, you were motivated, right? You came in, you're like, I want to get rid of this headache and migraines, and I want to exercise, I don't want to feel like that. Right? And it's awesome, like you responded very well to the physio, right? Remember the first assessment or the first treatment, we did a little bit of work on you and then you felt better, right? So that's a good sign. Kyle also is a big part too, right? That you got to be on board, right? You got to do your exercises, you got to be consistent, and through that process you start learning about, is it good pain, is it bad pain, right? What should I do? And I guess less scared of feeling those sensations, because it's normal, right? Yeah,
Absolutely. Do you have any other suggestions that we haven't talked, or we can go back for viewers to help them achieve their optimal physical health?
If you feel discomfort, if you notice that, like I'm unable to do this and that, like ask around, ask your doctor, see what you could do, right? Don't just take the pain medication and live with the pain. You want the physio, you want the chiro, you want the massage therapist to be able to help you. Then that means that it is musculoskeletal, right? If it's not, then we'll be able to tell you like, hey, go get more imaging or whatever, go back to see your doctor. And when you have pain, don't stop, right? Modify your activities. There's always something that you can do. People sometimes will say like, oh, I'm getting older, it's just, that's just the way it is. But yeah, we can't change like the surface of the bones and joints or whatever, but we can always make a change with your muscles, your ligaments and all that, right?
That's a good point, because I feel like we're engineered to accept at a certain point, like saying, oh well, this is the way it is, and I have limitations, or I have these pains, so I have back pains, I have these things, and I can't exercise, so that's just the way it is. But I think what you're saying is very important, saying, just take a pause and really think about what's getting in the way. Because I'm a strong believer, like people do well if they can. People have the capacity to achieve anything they put their minds to, within reason. But things get in the way. And I think often pain or discomfort gets in the way. We're programmed, our brains is protecting us from that pain, saying abort.
And it's also like, it can be pretty simple too, right? Like it could be like simple, like usually pain starts when you lose movement in one direction. So it could be just like, just do one exercise and your pain will go away, or let's maybe change a little bit of the way you're sitting, or do this instead of that, right? So it could be very simple solutions, and I think people don't realize that, right? Because they're feeling lots of pain, and they're like,
But I like that you're mentioning that range of motion, because I didn't realize that I had lost range of motion in my neck. And when I gained it back, it was like, I can turn my head around that much. And it's kind of scary saying like, you're late 30s, but like then you're losing mobility. To me, it was kind of a surprising thing, but I was never stopping to check or to think about, am I losing range of motion? And that has been a huge gain in the past 10 months for me.
So I'm just trying to feel for a knot, right? Especially a trigger point. So a trigger point is a knot that refers pain somewhere, and that's a good indication for dry needling.
Feels funny.
It does. It's like a surprising feeling. So when I put the needle, so you feel there's a twitch, right?
Yeah, it's a twitch inside.
Yeah. So
it doesn't hurt. It's just weird.
It's weird. So I find dry needling is like the best way to relax the muscle, right? When you have a knot or a trigger point, it's muscle fibers that are always like tangled up or engaged, right? It just doesn't know how to relax. Especially if you've had this pain for a really long time. There's a change in the chemicals in the muscle fibers. So when you insert the needle, I'm not too sure why you get a twitch, but that twitch kind of resets all the stuff inside those muscle fibers, and then so probably blood flow, oxygen, all that stuff. Okay, and that helps with the healing process. So you get that twitch along here. You felt that.
Well, thank you so much. That wraps up my questions. Anything else that you want to add? How can people find you?
I work at Active Health Institute, so in City Center, so you can check out our website. I also have an Instagram where I post, fun exercises and some tips. So it's at phannyphysio.
Perfect.
Yeah.
And you have your website.
And my website too,
We
yeah.
can put all your contact information down with this episode. And thank you so much again for your time.
Thanks for having me.
It was great. Thank you so much.
Thank you for tuning in to Vitality with Marilyne. Don't forget to join us on social, get involved in our communities, reach out if you have a powerful story to share, or send us a question you'd like answered. Take care for now, and don't forget to choose active, happy, and free.